Hey, what's going on, guys? Welcome to another video on my channel, HAIRLICIOUSLY. If you guys are new to the channel, please make sure to hit that subscribe button so you guys are updated on hair loss and hair transplant topics. Visit my website at HAIRLICIOUSLY.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth. My low-level laser therapy cap, DH tobacco shampoo and serum, hair growth vitamins, and a few other products for those who are losing hair. Today's video is sponsored by one of Turkey's top hair transplant doctors, Dr. Levent Acar from Cosmetica. He is one of the leading Turkish doctors in hair transplantation, and he has performed thousands of procedures with life-changing results. He utilizes the latest DHI Sapphire technology, which I talked about in a prior video. I will put up the link in the description box for those who want to check it out. You can visit his clinic at cosmetica.com and get a free online consultation. So I wanted to share with you some incredible before and after hair transplant results of clients who particularly had a more advanced stage of hair loss. And I'm talking about, Norwood 5, Norwood 6, Norwood 7. And these are individuals who usually had an early onset of aggressive hair loss early into their 20s or even their mid 20s, and some even younger. And once you kind of get past a certain point in terms of hair loss, usually anything higher than like a Norwood 5, it becomes really difficult to treat it solely with current mainstream FDA-approved medications, Minoxidil and finasteride, and even off-label dutasteride, because these are treatments that are more preventative in nature. And I'm talking about, finasteride, dutasteride. And as far as minoxidil, there's a lot of people who are not good responders as a result of not having enough sulfotransferase enzyme SALT1A1. And more oftentimes than not, you would really need to consider and resort to a hair transplant or two to bring back the density and the hairline. I will say that some people are good responders to treatment and can even reverse hair loss by a few Norwood levels. But these cases, as you guys know, are typically the exception. And most people who have already suffered from moderate to advanced hair loss need to look into a more direct approach, which is through hair transplantation. And with people suffering from advanced hair loss, one of the most important aspects is obviously going to be proper graft utilization. Given that we only have so many grafts that we can cover such an extensive area of hair loss, it's very crucial for a competent doctor to resource and allocate the finite number of grafts carefully by maximizing coverage with adequate density and at the same time being able to save up grafts for potential future hair loss. Norwood 5s and up, I think, will typically require a large number of grafts, and oftentimes, these are people who have to undergo what's known as mega sessions with implantations of 4,000 to 6,000 grafts, maybe higher for a single session. There are potential risks with mega sessions if it's not done by a proper doctor, and it can lead things to like, shock loss in surrounding native areas, low graft survival due to the surrounding blood supply being depleted, and even, over harvesting, which can result in unsightly scarring in the donor zone. So in general, you always want to do your diligent research when looking for a good, reputable hair transplant clinic before you guys decide to move forward. So I am going to be sharing with you guys some pretty remarkable before and after results from Cosmetica of clients who had a more moderate to advanced stage of hair loss who underwent a successful procedure. So this first example is a patient who was suffering from extensive hair loss, probably around the Norwood 6, eventually approaching Norwood 7. You can see some significant hair loss on the hairline and mid-scalp and even on the crown area. He is going to require a large number of grafts to fill in all the balding areas, but the good thing for him is that we can see some good density in the donor zone. One thing that I will mention is that if you look at the bottom portion of the back of the scalp where the nape hair is, notice how there's also some thinning going on. And I'm mentioning this because there are doctors who will try to utilize the nape hair, especially on the hairline, to kind of give that soft appearance, but this is not going to be a good idea because hairs on the nape hair, as you guys just saw, can also miniaturize as well. Anyway, this guy ended up with getting a whopping 5,000 grafts, and we can see the majority were used to place on the frontal hairline as well as the mid scalp, and some that were scattered on the crown area. The donor area looks really clean as well with the proper punch sizes, and this should heal up really nicely after a few months. So here is his 1-year post-op, which looks incredible. The density has really filled in and we can barely see any of the thinning areas on the scalp. Another great side shot, and his donor area looks pretty good in my opinion. And at that hair length, you can't even see where the grafts were extracted from the back of the scalp. And I think that's the beauty of FUE. You can cut your hair really short and the scars won't even be noticeable. So overall, this guy had great results, and I think he's going to be able to most likely maintain what he had as long as he is on hair loss medication. And sometimes these guys who had the frontal and mid scalp implanted with grafts can they can actually get away with not having to get on medication. The donor hairs are usually not prone to androgenetic alopecia, as you guys know, which are not going to be sensitive to DHT. But it's always recommended that you guys are on medication even after hair transplant, because the grafts that were extracted can actually be outside of the donor zone, and this would make it possible for it to miniaturize as a result of their sensitivity to DHT. So the general rule of thumb is to be on medication after a hair transplant and preferably before to minimize hair loss. The next guy's hair loss isn't as bad as the first one, but we can still see some extensive hair loss to the frontal portion and parts of the mid-scalp and crown. He will require some grafts on the temporal points as they have also receded. I think this is a great hairline designed by Dr. Acar. I think it's going to frame his face really well. The other thing that I noticed is that he has really coarse beard hair, which is definitely going to come to his advantage if he were to opt for a beard hair transplant into his scalp. Turkey is notorious for body hair transplants as well, so I think beard hair is going to work really well to add in the density, and he has that to his disposal if he ever needs more grafts. This is right after the procedure. Once again, a very clean result, and we can see that distinct hairline and the temporal points that were filled in. The donor area looks pretty good too, and these are some of the photos a year after his procedure. He's definitely got a lot of coverage and density on the frontal and mid portion of the hairline and the scalp. The crown looks really good too, but I think he's probably gonna need a second procedure if he needs to add in more density, in my opinion. But overall, I think it's a huge improvement from where he started off from. In this guy's case, he ended up getting 4,500 grafts in total. The next case is a guy who also had some severe hair loss going on in the frontal and mid portion of the scalp. A lot of miniaturization, as you guys can see, that is going on, and he's also likely to end up as a Norwood 7 later down the road. Good hairline placement, and the good thing is that, for this guy, he still has his temporal points intact, so there's not going to be any need for grafts to be implanted there. His curly hair is also going to benefit him, since curly hair can cover more area and give you the illusion of more density. So he ended up with 5,000 grafts. You can see that more density was added towards the frontal and mid scalp compared to the back region. And finally, after a year post-op, we can see a newly established hairline. We can see up close the single grafts that were utilized. And the thing is, his scalp may still be a little bit see-through or not as dense. And this is actually very normal, because honestly, you're covering such a huge area with just 5,000 grafts. And when you're covering a large area with a finite number of grafts, as it was in this case, you had to compromise the density to some extent. So he did get full coverage, but he had to work with less density per centimeter squared as a result. He also has some pretty good beard hair, which could later be used to fill in more density in the mid-scalp. But overall, I think he had some fantastic results, a lot of good coverage, and I'm pretty sure he's content with how his results came out. This next guy also had some moderate hair loss to the frontal and mid-scalp, as well as the crown area. Notice how all of these patients who had a more extensive type of hair loss usually ended up getting a much more mature looking hairline. Not only is it going to help save some of the grafts, but it is also going to be age appropriate. It's not going to make sense for this guy to drop his hairline into a Norwood 1 or Norwood 2, because that would just be wasting a lot of grafts, and it's also not going to provide adequate coverage. So right after his procedure, another very clean looking result, minimal redness and good graft placement by the technicians. And then a year post-op, after receiving 5,000 grafts, he has some pretty good coverage, at least in terms of density, nice hairline placement, which frames his face really well. And the side profile of him doesn't even make him look like he was balding in the first place. I think it looks totally natural, and it's amazing to see just how much 5,000 grafts can really make a difference. We've been seeing a lot of, these people getting 5,000 grafts, usually for Norwood 5s or Norwood 6s. And generally speaking, as you kind of go up each Norwood scale, you would need about 1,000 grafts. So starting with Norwood 2, you would typically need about 1,000 grafts. Norwood 3 would typically need about 2,000 grafts, and so on and so forth. And finally, the last example I want to share with you guys is yet another patient who had some extensive hair loss on the mid-scalp area and crown. We can see the pattern of hair loss in this photo, and he looks like he's on his way to a Norwood 7 eventually, probably after a few years. The temporal points have also receded, but it doesn't look like this is going to be rebuilt, mainly given this extent of his hair loss. I think sometimes not touching the temporal point is key, because you're adding that density to an area that has already thinned out, and sometimes it's going to look very unnatural, especially when you have grafts that are implanted into the temporal points, because the contrast of the hair thickness and density from the native hairs versus the implanted hairs can sometimes be pretty noticeable. So in this guy's case, not messing with it was probably the right thing to do, and he still has the temporal points. It's just that it's been miniaturized. We can see a better photo here of the extent of his hair loss, although he has some pretty good density in the donor zone and around the rim area, which is the back portion of the hair. But he ended up getting 5,600 grafts, and this is the results post-op. He's gotten, obviously a lot of density back to the frontal and mid-scalp area. Looks like he's been trying to grow out his hair a bit. Now, it might look like he's still using the frontal hairs to cover up, his forehead. But remember, his hairline was placed pretty high in the beginning, and he had no choice given his extent of hair loss. The side profile looks really good. We can see that he has amazing hair density and thickness, which is definitely coming into his favor. The crown area was also filled in really nicely, and it's difficult to see any signs of thinness in the area. So overall, great transformation and incredible coverage for such an extensive area, and now he's going to finally be able to style his hair. So I'm really happy for this guy. Anyway guys, that's all I have in today's video. Hope you guys enjoyed this content and saw some pretty amazing hair transplant transformations of individuals who had a more extensive type of hair loss. Make sure to check out cosmedica.com for more before and after photos of patients with various degrees of hair loss. And I would recommend that you guys utilize their free online consultation to get a free estimate of how many grafts you might need for a hair transplant, as well as the costs that are involved. If you guys have any questions for me, feel free to reach me via email at hairliciously@gmail.com, or you can leave me some comments in the comment section below. Thanks again, guys, and I will talk to you guys in my next video. Take care.